Winter effects on mental health, how to cope and thrive. Hi everyone, and welcome to my channel. Today, I'm going to be talking about the winter effects on mental health. Winter can be a challenging time for many people, especially when it comes to mental health. The shorter days, colder weather, and lack of sunlight can all contribute to feelings of sadness, depression, and anxiety. In this video, I will discuss what the winter effects on mental health are, the symptoms of winter depression and anxiety, and some tips on how to cope and thrive during the winter months. What is the winter effects on mental health? The winter effects on mental health is a term used to describe the negative impact that winter can have on mental health. This can include a range of symptoms such as feeling sad or depressed, feeling anxious or stressed, losing interest in activities you used to enjoy, having low energy levels, feeling tired all the time, having trouble sleeping or waking up, feeling hopeless or worthless, experiencing changes in appetite, having difficulty concentrating, having thoughts of death or suicide. What are the symptoms of winter depression and anxiety? Seasonal affective disorder (SAD) is a type of depression that occurs during the winter months. The symptoms of SAD are similar to those of depression, but they typically go away during the spring and summer months. Winter anxiety is another common condition that can occur during the winter months. The symptoms of winter anxiety are similar to those of anxiety, but they may be more severe during the winter. What are the causes of winter depression and anxiety? The exact causes of winter depression and anxiety are not fully understood, but there are a few factors that may play a role. Lack of sunlight. Sunlight exposure helps to regulate our circadian rhythm, which is our sleep-wake cycle. During the winter months, we get less sunlight exposure, which can disrupt our circadian rhythm and lead to feelings of depression and anxiety. Melatonin production. Melatonin is a hormone that helps to regulate sleep. During the winter months, our bodies produce more melatonin, which can lead to feelings of drowsiness and fatigue. Serotonin levels. Serotonin is a neurotransmitter that plays a role in mood regulation. During the winter months, our serotonin levels may decrease, which can lead to feelings of depression and anxiety. How to cope with the winter blues. There are a number of things you can do to cope with the winter blues, such as get regular exercise. Exercise releases endorphins, which have mood-boosting effects. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Get enough sunlight, even if it's cloudy outside. Try to get some sunlight exposure every day. Go for a walk, sit by a window, or use a light therapy lamp. Eat a healthy diet. Eating a healthy diet can help to improve your mood and energy levels. Avoid processed foods and sugary drinks, and focus on eating whole, unprocessed foods. Get enough sleep. Sleep is essential for good mental health. Aim for 7 to 8 hours of sleep per night. Connect with others. Social interaction can help to improve your mood and reduce feelings of isolation. Make time for activities that you enjoy with people you care about. Winter self-care tips. Winter can be a stressful time of year, so it's important to take care of yourself. Here are a few winter self-care tips. Set realistic expectations. Don't try to do too much during the winter months. Give yourself time to relax and recharge. Take breaks. Take breaks throughout the day to do something you enjoy, such as reading, listening to music, or taking a walk. Say no. It's okay to say no to commitments if you're feeling overwhelmed. Do things you enjoy. Make time for activities that you enjoy, even if it's just for a few minutes each day. Ask for help. If you're struggling to cope, don't be afraid to ask for help from a friend, family member, or mental health professional. Mental health tips for winter. If you're experiencing winter depression or anxiety, there are a few things you can do to manage your symptoms. Talk to a therapist. A therapist can help you to understand your symptoms and develop coping mechanisms. Consider medication. If your symptoms are severe, your doctor may prescribe medication. Join a support group. Joining a support group can provide you with emotional support and connect you with others who are experiencing similar challenges. Create a cozy and inviting home. This can help to reduce stress and create a sense of comfort and well-being. Add candles, blankets, pillows, and other items that you find soothing. Spend time in nature. Even a short walk outdoors can help to improve your mood and boost your energy levels. If possible, spend time in nature during the day to get some sunlight exposure. Try aromatherapy. Essential oils such as lavender, bergamot, and chamomile have been shown to have calming and mood-boosting effects. You can diffuse essential oils in your home or add them to a warm bath. Listen to music. Listening to upbeat music can help to improve your mood and reduce stress. Practice relaxation techniques. Relaxation techniques such as deep breathing, meditation, and yoga can help to reduce stress and improve your mood. If you are struggling to cope with the winter effects on mental health, please reach out to a mental health professional for support. They can help you to develop a personalized treatment plan and coping mechanisms. Here are some additional resources that you may find helpful. Mental Health Help in the UK. If you are struggling with your mental health, there are a number of resources available to help you in the UK. Here are some of the most important. Your GP is often the first person you should see if you are struggling with your mental health. They can assess your needs and refer you to specialist services if needed. NHS Talking Therapies. NHS Talking Therapies is a free service that offers a range of talking therapies, such as cognitive behavioral therapy (CBT) and counseling. You can refer yourself to NHS Talking Therapies or be referred by your GP. Mental health charities. There are a number of mental health charities in the UK that offer support and advice. Some of the most well-known include Mine, Samaritans, and Anxiety UK. Crisis support. If you are in crisis, you can call 999 or go to A&E. You can also call the Samaritans 116,123 or visit their website for support. Online resources. There are also a number of online resources available to help you with your mental health. Some of the most useful include Nshivri Mind Matters, Mine, Samaritans, Anxiety UK, mentalhealth.org, support for young people. If you are a young person and struggling with your mental health, there are a number of resources available specifically for you. Some of the most useful include Young Minds, Childline, The Mix, Kuth, Mental Health in the USA, National Alliance on Mental Illness NAMI. NAMI is a national organization that provides support and resources for people with mental illness and their families. Mentalhealth.gov. Mentalhealth.gov is a website created by the U.S. Department of Health and Human Services that provides information and resources on mental health. Crisis Text Line. Text HOME to 741,741 to connect with a crisis counselor 24/7. Rest of the world, please contact your local mental health helping bodies. Remember, you are not alone. There are people who care about you and want to help.